And we are back. It is day 3 of Annual Conference Live 2019, bringing you exclusive conversations with leading figures in the early childhood field. I've got with me today 4 very distinguished leaders in the early childhood field, a really distinguished group of people. Later today, they are going to be presenting on a presentation titled Inequity in Infancy, Racial Disparities, and African American Infants. To all of you, thank you so much for joining. I'd love to introduce one by one. Directly to my left, we have Kathy Costa from the Baltimore City Health Department. Kathy, welcome. Reiko Boyd, PhD from the University of Houston. Ioma Iruka, PhD from High Scope. And Brenda Jones-Harden, PhD from the University of Maryland. Thank you all so much for joining us today. So, Brenda, I want to start with you. You do really important research that focuses on a lot of the racial disparities that African American children experience. And we know that when it comes to these disparities, a lot of them have very early roots, particularly in the infant and toddler age range. Can you speak a little bit to what the evidence shows is happening with African American children in these earliest years?
Sure, thank you, Mauricio. In fact, one could argue that African American children experience disparities on almost every indicator of well-being, whether it's in the physical health domain, in the cognitive academic functioning domain, in the social emotional domain, and how they receive services in the systems, all the various child servicing systems that they encounter. For example, we know that infants and toddlers begin to show signs of obesity. African American infants and toddlers do. We also know African American infants and toddlers, which Kathy's going to talk about today, have much higher rates of infant mortality. We also know that we see language development gaps in the toddler period that end up predicting their academic outcomes, which Ioma is going to address. We also know that African American children are more likely to have mental health problems, whether that's because of the environmental stressors that they experience or whether it's because of how people view them in the classroom, but they end up with higher rates of special education placement. They also end up with higher rates of grade retention. They end up having high school graduation rates that are less. So these early experiences end up with very poor outcomes for them down the line. Now, one thing I do want to say, and I want to make this clear,
Yes.
there are lots of reasons for that. It's a very complex phenomenon. But basically what we see in this country, unlike in many other countries, is this confound, we call it in child development research, between poverty and race, which of course brings to bear many other adverse experiences for African American children that render them more vulnerable to these kind of adverse outcomes that we see. And then you add that to how the environment treats them, all these service delivery systems, whether they get the kind of supports and treatment and interventions and health interventions that they need, then what you see is a compounding of these experiences, which results in their negative outcomes, again, on almost every indicator of well-being.
Wow. It really runs the gamut in the indicators.
Across the
clear.
developmental domain.
Wow. Well, thank you, Brenda. And you cue us up for, if we could bring the microphone to Kathy. Brenda brings up this issue of disparities in infant and maternal mortality for African American families. Can you speak specifically to what the research has to say about those disparities? And then, relatedly, what are some maybe promising practice that might be able to address this issue?
Sure, I'm happy to speak to that. I mean, around the country, Black infants are dying at a rate 2 to 5 times higher typically than white infants in their communities. And what that really has to do with is maternal health. The leading cause of of infant mortality, particularly for Black women, and the driver of the disparity is very premature delivery and low birth weight. And so that's very much to do with the mother's health prior to pregnancy. And a lot of the research that we're seeing now builds on research of the 90s around the weathering hypothesis and the concept of allostatic load, where we're really looking at the impact of stress and accelerated aging on women's bodies. And the experience of living in adversity day to day, the experience of racism, creates this weathering on Black women's bodies to a much greater extent than those of white women, and we're seeing the impact of that on their pregnancies and the preterm delivery of infants. So I think that there's also some really good research coming out too around environmental racism and the impact of the environment, pollution, so on preterm low birth weight babies, and I think that is a growing area as well. But it's really the issue of racism, I think, that is most salient.
So, and let me just ask you this, because racism certainly a term that a lot of us are familiar with. When you say environmental racism, can you speak a little more to what that means?
Sure. I think, on one level, it's that there are issues like pollutions or brownfields or other sorts of hazards in our environment that people of color are disproportionately exposed to because of where those sites are placed. So for instance, in Baltimore City, we have an incinerator that creates a tremendous amount of air pollution, and it's right in Cherry Hill, which is a predominantly African American neighborhood. The children in that neighborhood suffer very severe asthma and other issues, and there's quite a high rate of low birth weight preterm birth.
Wow. And then as you review sort of what we know, what kind of promising practices have been identified to try and target this issue of mortality for infants and mothers?
The most important thing I think we can do right now is help women make social connections and get really strong social support. And so there have been wonderful initiatives to provide women with access to doulas, which they may not have had in the past because of income considerations. So I know we're working in Baltimore to expand access to that. In general, any kind of peer support or group-based programming has the ability to lower stress and increase well-being, and also help women advocate for themselves in healthcare. That's the other thing I think that's really critical to raise, is that we're seeing the impact of racism on people's health, but we're also seeing the impact of racism in healthcare. And so it's promising practices are around training health providers around implicit bias and making sure that healthcare is free of discrimination.
Great, thank you. If we could bring the microphone to Raiko. Raiko, we know that another area where racial disparities are seen are in the child welfare system. Can you speak to that, and then also relatedly speak to the efforts being taken to try and reduce those disparities?
Absolutely. So what we know based on a wealth of research is that racial disproportionality and disparities for African American children in the child welfare system are persistent, and they continue to be present. And that we observe that across each decision point in child welfare. So in terms of who's reported to the system, which reports are substantiated, the likelihood of placement in foster care. And then we also see racial disparities on the back end in terms of the duration of placement and length of stay in care, and also exits from care in terms of permanency, for example, exits to adoption and guardianship. And so what has happened over time is we're becoming more aware, more understanding of the complexity of the problem. We know that we can't just reduce the causes to one single factor, and I think that understanding helps us, has really been manifested in some of the approaches that are being taken and have been taken over, I would say, the past decade to address this complex problem. So one of the ways that I like to think about it is in terms of the pathways that contain factors that contribute. So in terms of we recognize the disproportionate need based on the risk factors and a lot of the disproportionate exposures that have already been discussed in this conversation. So in addition to that, there's this aspect of human decision making that's particular in child welfare. And so that's another pathway that helps explain and inform our understanding of the problem, but also helps us understand how we can respond. And examples of promising practices are certain trainings that increase awareness of implicit bias, and also just how to standardize decisions and so that we can counter bias and partiality as well. In addition, we know there are agency level factors, so that specific to agencies and systems that contribute to the patterns that we see, as well as issues specific to placement. For example, challenges to kinship care. So kinship care on one hand is awesome because we are able to maintain a family bond, but on the other hand, some research shows that kinship care providers often receive less services despite the fact that they have more challenges in taking care of family. I also would be remiss if I didn't highlight the fact that policy also contributes to the issues we see, and it's another area that's ripe for action as well.
Great. Well, thank you so much. And as we're thinking about solutions, ways that we can tackle this issue, I'm wondering, Ioma, if you can speak to the ways in which early childhood education might serve as an avenue for addressing these issues of disparity.
Sure. So I want to point out and emphasize that early childhood is not a magic bullet. But I think, as you just said, Mauricio, it's a potential vehicle and strategy to alleviate some of these issues. So when we talk about early childhood, it looks very different. It's very diverse in terms of it could be a home-based childcare, center-based, school-based, full-time, full year. So there's a diversity of what early childhood could be. And many ways that they can, I think, really address the disparities is really through ensuring you have a really strong, stable, well-trained, well-compensated workforce, right? So that's one of the angles. To have a high-quality early child experience, you need to have a teacher or caregiver who knows what a child needs, what they're experiencing, has a culturally affirming environment, interactions that are conducive for children to learn, to grow, but to also feel safe, right? So part of early childhood has to really take into account what do young children need to thrive and be their best. So the workforce has to be strong. That also means that we can't expect early childhood to do everything, right? But it could be a mechanism to provide supports to children, whether it be mental health, to also support the families, right? So children, again, are within a bigger system, which is their family and communities. And so, for example, we know about Head Start, which is a federally funded program, which is support children and families from low resource communities. And part of that is not just about the child and what they're learning in the classroom or program, but it's also about how do we support the families to be economically stable and sufficient? How do we ensure that communities are thriving? And so how do we take more of a generational and community-based approach to really these issues, right? Because I think, as everybody has already articulated, it's a complex issue that requires a lot of people to be part of the solution. And so early childhood could be one of the places where that happens in many ways. And so another thing I'll point out is that we have also understood that while early childhood really started because really of black children, because there was a need to say black children should be prepared for school, they haven't actually benefited completely from the early childhood programming and policies. And we find a lot of black children are in low quality programs, right? They're likely to be in out of home care, but they're also likely to be low quality, which also means that they're not experiencing that rich, affirming, high quality, language rich environments. And so we have to do more about that. And I think the underlying issues about bias, right? That certain people think that some children are not able to meet expectations, are not able to meet and thrive in certain environments. And so we have to think about how do we see certain groups of children. And I think early care education can do more in that realm as well.
Perfect. Well, thank you. Thank you all so much for taking the time to speak to us about such an important topic. And I think you hit the nail on the head. You speak to the complexity. It's complex. Our viewers at home, if they want to learn more, both just about what we know about disparities, and then also some approaches that are trying to address that issue. Where can they go for more information?
So I'll start really quickly. First of all, 0 to 3 has a briefing paper on racial inequities in infancy and toddlerhood that I think is a good general description of the problem and talks about specifics and where they can go. I also think Frank Porter Graham, which is another institution in University of North Carolina, has written on this. So those kinds of organizations have generic resources that I think would at least help people understand the scope of the problem and give them some ideas of where to go. But I think there are also specific ones that all of you could share.
So I'll just list two. Obviously, I'm part of High Scope, which is part of the preschool study that helped substantiate that early childhood does matter, not just for school readiness, but also for lifelong outcomes. And it's a return on investment, right? That it shows that when you start early, there's return on many, many levels. But the other area I'll also sort of recommend is there's a lot of reports from the National Academies of Sciences, Engineering, and Medicine, and a lot of that really is through committees, and they're like, here's the evidence of what works, what matters, and what works. So I would suggest that people look at some of those reports because they have both science information but also practice information for practitioners, for policymakers, and community leaders.
Great.
A couple of resources I would recommend for a big picture national level. I would say the Center for the Study of Social Policy has a lot of great resources on the topic and related topics. Also, the Child Welfare Information Gateway is a great resource to get information. But I would also, in addition to that, just recommend doing a local search to understand what's going on at the local level. There are a lot of local initiatives and efforts being taken that are specific to certain geographic areas. So I would suggest that as well.
Perfect. Thank you.
And to learn more about racial disparities in infant mortality and maternal mortality, two really important resources. One is the documentary series Unnatural Causes, and you can find the episodes from that series and clips online. But the second episode has a really good breakdown of the science around racial disparities and infant mortality. And then the second resource is really the Black Mamas Matter Alliance. They're a group out of Atlanta, but a national group of women of color who are really lifting up the issue of maternal mortality and racial disparities. They have tremendously good resources on their website and a policy agenda we should all pay attention to.
Great. Great. Thank you so much. A wealth of information. Be sure to check up on those and make sure to check back in with us. We've got so many more great conversations with leaders in the early childhood field. Make ssure to tune in at 0to3.org/AC Live for all of the rest of the conversations. Thank you.